Hi, welcome to our webinar. We're going to talk about alternative methods for your back pain and neck pain, and my name is Jade Millay, and I hope to spend the next 30 minutes or so with you, giving you some information that you may have not heard before. So our name of our facility is Apex Physical Medicine, and we're a team of chiropractors, massage therapists, nurse practitioners, and also medical doctors. And together we have about 35 years of graduate work, and we're here to help you with all your musculoskeletal needs. Our purpose is to offer you alternative treatments, non-surgical, non-invasive, that have no side effects, and hopefully offering these to you to offer you a more permanent solution at an affordable price. About 75% of the population will experience back pain sometime in their lives. Billions are spent to treat back pain, and it's the #1 reason why people miss work. And one of the main causes is our sedentary lifestyle. So our poor posture, sitting at a computer all day long, we're very sedentary lifestyle now these days, and we spend the majority of our day sitting. Also, excess weight. So the majority of Americans are overweight or obese, and an extra pound can add 10 extra pounds of force on the joints. Also, stress. That's self-explanatory, I think. Back pain is also showing up in children. So there's an actual diagnosis now called text neck. So all of us are looking down instead of having our heads up like we're supposed to, and this is creating more problems. So the treatment now, the question we want to answer is, are we on the right track? With the incidence of neck and back pain increasing, there aren't very new options that are available as far as from the medical community. So is it possible that we're not doing the right thing? The main cause of most back pain is the disc. So this is a picture of the disc. The disc looks like a jelly donut, if you will. It has a soft jelly center and some tough outer fibers. And this is the main problem that most people are experiencing, is a problem with the disc. So the current treatments that are available are things like physical therapy, chiropractic, exercise, drugs, acupuncture, massage, and unfortunately none of these treat the disc. There is surgery available which can cut out part of the disc, but it really doesn't have a long-lasting effect, and it can create other problems. It has risks, side effects, and scar tissue can also develop. So there are two main problems that the disc will encounter. It's either disc degeneration or disc herniation. A disc herniation has also been known to be called a bulging disc or a slip disc. So did you know that the disc is mostly made up of water? A lot of people don't know this. Also, as we get older, the disc has no blood supply. So it's a very, very tough tissue to heal because of these two main components. The disc is about 80% water. So as we age, we stop moving as much. That is mainly how the disc gets its water and nourishment to it. These discs will start to build up waste products. They will start to thin down and degenerate, and this can lead to nerve problems leading to arthritis, and this can become a vicious cycle. So here we have a post-mortem or an example of what the disc can look like. On the left-hand side, we have an example of a healthy normal disc. And you can see how the disc, which is in between the bones, is very thick and it separates the bones very nicely. And then on the right-hand side, we have an example of an unhealthy disc. You can see how that disc has definitely thinned down. Those bones are becoming closer and closer to one another, and we can see the beginnings of arthritis as we see those lips starting to occur as the bone degenerates. So arthritis can be caused as the discs degenerate because there is no shock absorption. So as this happens, more of the weight gets transferred off the disc into a part of the vertebrae called the facet joints, and this is what leads to bone spurs and problems around the facet joints. And this can also lead to nerve compression and cord compression. All this together is called arthritis. You may have also heard your doctor refer to it as DJD, which is degenerative joint disease. So how do disc herniations happen? As we talked about, the disc is like a jelly donut, and through things like lifting incorrectly, long periods of sitting, the most common cause is improper lifting. So as these things happen with time or a one-time event, the disc is very vulnerable to these changes. So here we have an MRI of what a disc looks like. So if we look at the bad disc, which is the dark disc in the middle of the frame, you can see how the disc material is bulging out the back side. And as the disc loses water, it starts to darken. We call this a black disc. On top, on the bottom of that disc, we see how the healthy discs around it turn up white or bright. So you can definitely see how that herniation impinges on that spinal cord, which is coming down, and the spinal canal. As this happens, this can pinch on the nerve and lead to a very painful situation called sciatica. So this is the typical pain that someone may feel out of their back going into the buttocks and down to the leg. And this can cause pain, numbness, and tingling. When this happens in the neck, this can also go down into the arms, into the hand. And a lot of people who have arm and hand pain, the problem is not in the arm or the hand, really. It's really coming from the neck and the discs in the neck. So how do we figure out this problem with you? We can use things like your history, x-rays, MRI, muscle testing, because these nerves, when they come out of the spine, they go to the muscles. So if the nerve is being interrupted, the muscles will get weak. Things called dermatomes or sensory patterns, and deep tendon reflexes. So currently how back pain is being treated is mostly with pills, muscle relaxants, physical therapy that only stretches, surgery, which actually cuts off the disc material, epidurals, which temporarily numb the nerve, exercise, and chiropractic adjustments. Only surgery out of this list specifically address the discs. Painkillers. There's a lot of side effects from these things. Addiction, constipation, bleeding. And these, again, don't specifically treat the discs. Studies show that 10 to 20,000 deaths per year are caused from these NSAIDs, nonsteroidal anti-inflammatories. The most common of these is Celebrex and ibuprofen. And again, these can have side effects like nausea, headaches, constipation, diarrhea, kidney failure, liver failure, and ulcers. And again, these just hide the pain. It doesn't specifically treat the disc. Physical therapy is something that's commonly suggested by your medical professional. And the great thing about physical therapy is it does strengthen and lengthen the spine and creates more flexibility. But again, the problem is it doesn't specifically treat the discs. And sometimes, because you're not treating the actual problem, this can make the problem worse. Spinal fusion. So here is a picture of someone who has undergone spinal fusion. You can see the bars there and the screws there. And this is what it looks like on an x-ray. The drawbacks from this type of surgery is that a lot of times people don't have significant relief. Things like microdiscectomy, 29% return to their previous occupations without pain medications, and 1/4 of patients are dissatisfied with their surgeries 2 years out. Fusion, the problem with fusion is that it wears out the segments above and below that aren't fused, and this can lead to the need for further surgery. Also, scar tissue can develop. This can lead to another host of problems, inflammation and restriction. Someone will see this in a less ability to move. Discectomy, what it does is it essentially removes the disc material, not really treating the actual problem. 72% of patients will most likely need further surgery. If you talk to someone who's had back surgery, they will tell you this, that as time goes on, the levels above and below start to wear out, and then the recommendation is to have more surgery. Less than 25% will be completely successful, according to Dr. Eugene Karagi from Stanford University. So that's a pretty low number for undergoing such a big ordeal, a big surgery like back surgery. Dr. De Palma says no operation in the field of surgery leaves in its wake more human wreckage than surgery on the lumbar disc. Many of these patients are subjected to numerous operations, and after each operation, the patient is worse. So let's talk about laser surgery. Is it the next big thing? Some experts warn that laser surgery is inexpensive. It's ineffective, it's expensive, and it's potentially dangerous. And there's not enough research out there that shows that this type of surgery has a better outcome than traditional surgery. And again, there's a big price tag with this type of surgery. So are we doing the right thing? Looking at what we just looked at, it doesn't seem like we are doing the right thing. So what's next? How back pain can be treated now. So spinal decompression is a potential solution for a lot of people listening on this webinar. Until now, we know that physical therapy, drugs, and surgery were the only options. Now we have spinal decompression, and it is becoming the leading solution for neck and back pain. So how this technology came about is realizing how much pressure the disc is under when you're just standing or sitting. You can have 100 to 300 millimeters of mercury of pressure placed on it. And this is because we're on Earth and subject to gravity. So this shows you the different positions that we're in and how much pressure is on those discs. So as we sit, you can see that the pressure starts to really go up, and as you lean over as you sit, the pressure really starts to get astronomical. So the solution is to take that pressure away. So how we kind of stumbled upon this, was seeing astronauts who went up into space that had back problems and disc problems. And in space, of course, there is no gravity, so their discs were not subject to this type of gravitational pull and force, and their back pain healed all on its own. And so we started to take this type of information and try to make a machine that would help people on Earth. And this is what led to spinal decompression therapy. We know through studies that when someone is on a spinal decompression machine, that the pressure inside the disc can drop all the way to a negative 200. So going from that previous slide where you saw that the pressure in the disc can go up to 250 upwards towards 300 plus millimeters of mercury, this machine can take the pressure down to a negative 100, and that creates suction. So decompression treats herniated disc, degenerated discs, Facet syndrome, sciatica, and chronic neck and back pain. The typical protocol is about 2 to 3 treatments per week. We can treat patients safely all the way up into their 80s. It's comfortable and safe. Most people fall asleep when they're having the treatment done, and the treatment takes up about an hour of your time. There are some things that we want to watch out for when evaluating someone for this treatment. Some people who may not be eligible candidates would be people who are pregnant, someone who has some type of bone softening disease, such as cancer or osteoporosis, someone who's had aortic aneurysm, and we will see this as we evaluate you. We see this on X-ray. And then certain types of surgical fusion. So not all types. We've had success with people who've had surgery and surgical fusion. So that's part of our consultation that we perform on each person to make sure that you would be a good candidate for this type of treatment. So who's using this type of technology? All fields of medicine and healthcare are using this technology now. Neurologists, medical doctors, physical therapists, chiropractors, orthopedic surgeons have swung to using this type of conservative care. So how it works, by getting on the table and engaging the machine, we're able to specifically direct the machine at a specific force, angle, time, and frequency, and this creates a negative pressure inside the discs, creating like a vacuum or suction. So it allows that disc material that has herniated or bulged out to be sucked back in, and along with that, pull in water, blood, and nutrients that the disc needs in order to heal. So what we've seen as this technology is getting more and more popular is that people with this type of problem will have their pain in their leg will start to go away, their numbness will go away. The typical protocol is approximately 5 weeks and about 20 treatments. So we'll see a reduction in the herniation size. Up to 90% reduction of the herniation occurred in 71% of patients. 90% had numbness in their leg disappear, and 86 had a good to excellent relief of their sciatic and back pain. And only 6% reoccurrence rate in 1 year. So this is why this is an optimal choice as opposed to traditional back surgery, because if you remember from the previous slide, most people after 2 years were unsatisfied with their back surgery. So with most people, pain went down from a number 10 down to a 1. They no longer felt pain into their buttocks or leg. They had improved strength as a result, and redoing an MRI showed that the herniation reduced in size. Next, what we're going to listen to is someone who went through spinal decompression. Her name is Manal, and she's a young lady that when she came in, she had done some radical treatments. She actually had a rib removed, so she was having neck pain and having numbness and tingling and weakness into her arms and hands. And so she had several nerve blocks, as I mentioned, a rib removed, and this was greatly impacting her life. She had to drop out of college because she couldn't grip a pencil anymore, and the pain was unbearable. So she came to us because she had already done the most invasive things and didn't know what else to do, and we put her on the machine for her neck, and she'll tell you the rest.
My name is Manal Patel, and I completed my therapy about 5 months ago, and I still feel great. I don't have any pain. I can do all of the things that I couldn't do before. I'm back to my normal life, and I love it. This therapy has made such a difference in my life, and I can focus more in school. I completed an entire semester of school, taking all my classes and not having any trouble, not taking any time off. Haven't had any nerve blocks or any other issues, and I can do all the recreational things I want. I can drive more, I can play sports again, I can work out, which is great. This has just made such a big difference in my life, and I know that the results are going to continue, and I recommend this to anyone that wants to make a big difference in their life and start living again.
We're about to listen to his situation was unique in that his sister had back surgery, and she ended up paralyzed. So he knew that he definitely did not want back surgery, and he'll tell you the rest.
About Dr. Malay on Facebook, actually. About 2 months ago, I pulled up my back from a number of different activities that I was having. I was in Mexico playing beach volleyball, came back and played in a racquetball tournament, had 3 rounds of golf, had a party in which I was lifting a lot of china glass silver, and I woke up on July 4th and I couldn't move. And my other chiropractor, who I've been seeing for 5 years, she was getting married, and the pain was just so great I couldn't stand waiting another week. And checked Facebook later on that day, and there was just a notice about, are you having back problems? And I immediately was interested, called Dr. Malay. She was able to see me immediately and set up a treatment for me that started with shots with Dr. Dave, this wonderful machine, DRX 9000, that Frank Nobilo, a golfer, which I'm a golfer, he created. And after about 2 weeks of treatment, I was out of pain, pain level at about 0. I'm now into treatment number 14 out of 20. I'm back to playing racquetball. I'm back to working out. I'm back to doing all of the daily activities that 2 months ago I didn't think I could ever, do anything, let alone walk without just excruciating pain. I feel blessed that Dr. Malay is in my life. Their team of experts treat me very, very well professionally, and I feel like they care. And all of the other supplementary type things that I do, that they've given me to help with strengthening my core to prevent injuries is terrific. My sister had back surgery, and after back surgery she was paralyzed, so I certainly wanted to do something that was non-invasive, non-surgical, and Dr. Malay and her team provided that for me.
So again, how this works is it creates a negative force, and by creating that negative force, it draws in blood, nutrients, and oxygens to rehydrate the disc and create a natural environment for healing. And this will allow the disc to become taller and therefore take the pressure off the nerves. Again, and this type of technology we have shown repeatedly through studies that it shows an 86% improvement rate. But will the results last? So this is the big question, because we have seen that with surgery that the results usually aren't long lasting. So through studies we have seen that over 80% showed 50% or better pain reduction at the end of a 4-year study. And greater than 50% still had a pain level of 0. So that's a pretty good representation of what this type of technology can do as opposed to traditional back surgery. And so here we see the graphic showing that before spinal decompression, what their pain was. It appears to be at least a level 7, and then after 4 years, we're looking about at a 1, maybe 1 1/4. So the comparison of decompression to drugs is there is no side effects. The results are long lasting and it fixes the problem rather than masking it. As opposed to surgery, there's a higher success rate, 71 to 86% as opposed to 25 to 50. It's 10% the cost of surgery and the risks are minimal. So is decompression my best option? Dr. Ramos says manipulation, acupuncture, steroid injections, anti-inflammatory agents, and muscle relaxants all fall short of addressing the underlying problems associated with disc problems. Decompression should be utilized in all patients who are poor surgical candidates and before surgery is undertaken. So even Dr. Ramos agrees that decompression is the first thing that should be tried before resorting to surgery. We offer other ancillary services along with decompression to help speed up the healing process, such as lasers. Lasers are being used more and more in healthcare, and the laser that we have helps promote the healing process. We also, for low back patients, we probably will give you a lumbar brace. This will help support the spine. We don't leave it there. After you're done with your decompression or as we're going through the process, we want to start rehab, so we want to strengthen the muscles alongside the spine. Also, we also implement injections. So this is where our nurse practitioner comes in, and she's able to inject a natural pain injectable that helps with inflammation and breaks up little balls of muscle called trigger points. And then also addressing posture. So we saw from the very beginning how posture is a big proponent of this problem, so correcting some of the posture problems that we see with people. And next we're going to see a patient named Elaine Randall, and she's going to share with you her experience here in our office.
I heard about Dr. Millay through the internet. I was on Facebook and I saw the ad for Apex Physical Medicine and I thought that, well, I'll go check it out. So I was coming in for my knees, but then I also heard about the treatments for low back symptoms, SI joints, and trigger point joints and everything else with their Serapin. And so I thought I would go ahead and give that a try. And I had some today and I can already feel it, working. I'm feeling better, and I'm sure it'll be even better after I have a massage. They tend to work the knots out. And definitely would recommend Dr. Millay to anyone. Actually, I already have. So you need to come see Dr. Millay because she and her staff are the best.
For you, for the first 25 callers, what we want to do for you for being on this webinar for us is to come in and receive a complimentary consultation, which will include, if you've had an MRI, for us to take a look at it and give you our opinion. We'll also do some computerized range of motion and muscle testing. If we feel like you need x-rays, we'll do that as well and give you a complete analysis of your condition. So if you want to call the number down at the bottom, or you can also go on the website and schedule there as well. So thank you for joining the webinar today. I hope this information was helpful to you. And again, feel free to reach out to us and see if we can do anything to help. Have a great day.